Good evening, everyone. My name is Andrew Asato, the CEO here at Susan G. Komen, Oregon and Southwest Washington, and I want to thank you for joining us again this week. We have a wonderful guest that I'll introduce in a minute. But for those of you that have not participated in our Health at Home Facebook Live series, if this is your first time, you can go back and watch the previous 2 episodes that are on our Facebook page. So do please take that time if you can. So the last 2 weeks, we've been focusing on patient care and concerns and questions about treatment for those who are currently in treatment. Do I go to the doctor? Will my treatments be postponed? How do I interact with my physician? And Dr. Nathalie Johnson from Legacy Health helped address that, a surgical breast oncologist, and as well as Dr. Storm Dickerson from Compass Oncology, also a surgeon. And I found that the questions and the feedback were very positive, and we've gotten incredible commentary on how important this intimate time is together. And this is a series we're going to continue to do. But with tonight, we're going to make a little bit of a pivot. And as we talked about the physical well-being, tonight's a conversation about the emotional well-being in this new normal and dealing with the stress of living in the age of COVID-19 and the impact on breast cancer, specifically metastatic breast cancer patients who are homebound, unable to leave their house in isolation. So without further ado, I'd like to introduce our wonderful guest, Dr. Valerie Correa. And Doctor, I want to start by asking you, could you share a few words about your own personal background as well as your professional background?
Yes, I'm a licensed psychologist in Oregon and Washington. I'm also a licensed marriage and family therapist in Washington. And I work currently at Legacy Good Sam in their healing center as an oncology psychologist. I'm also a founder of Sunrise Daisy Retreat, which we do retreats for free for cancer survivors once a year. We unfortunately just canceled ours for this year because of the virus, but we're going to for sure come back next year. And I'm also an OHSU research ambassador, which just helps connect the research to do cancer prevention out into the community so we get as much positive outcomes as possible for our Oregonians in Southwest Washington. And then I'm a supervisor, I train therapists, I supervise supervisors of therapists. I'm a professor, adjunct professor, and so I do some other things along the way too. And I used to be in private practice. And then personally, I had acute myeloid leukemia in 2013, and that is primarily an inpatient treatment process that takes about a year with a few breaks on and off. And then I could only survive with taking on the immunity of somebody else. So I had a stem cell transplant in 2014 from an unknown German donor who I actually met, and we did a orca tour in the San Juan Islands, and she's lovely. Her name is Gabby Kramer, and I'm thankful for her as being my little miracle worker. And so I've had a kind of a near-death experience with cancer, and I worked in private practice and did cancer work before my diagnosis and thought I understood cancer and really serviced the people I needed, but my personal experience gave me an insight now that I think has been really even more helpful to my patients. So
It's so wonderful to hear the outcome.
Yes.
Thank you for sharing that with our viewers. So first question I wanted to ask you is, how does your emotional well-being play into your overall health?
Yeah, I think the nice thing is we're finally getting through the importance of mental health as equal to physical health and how the mind-body interacts. And a couple of years back, they found that there's a vagal nerve that connects the brain to the body. And we always used to say mind-body connection, but they actually now are able to find that they thought it was just like one train track down, and they opened it up and found out it's like a tree branch of like so many things. So I think we're learning so much about like the gut biome and the capacity of the brain and just how all those things are influence immune function and how depression, anxiety, and PTSD and other mood disorders are impacting the immune possibilities. So I think we're finally getting at a place where people are realizing, like my job, they realize that we're seeing better outcomes when people can manage their anxiety and their depression and their trauma better. They're able to focus on their treatment. They'll be able to get through their treatment. They'll be able to make more positive self-care choices after treatment to prevent recurrence. And then for metastatic cancer patients, that it's such a difficult time to balance that inner space of self-care, but also like a hedonistic, if I'm only going to live once, I need to do whatever I want to do, and so there's this push-pull that happens when your life is threatened, and managing that is a really mentally challenging time. And so I think we're learning more and more how those two things are intersecting. I was in the 90s, I did medical family therapy in Connecticut, and that was just kind of starting, is like, how do we connect the mental health with the physical? And now I think we're having science back it up more than just philosophy.
So it would be safe to say that if your overall mental health isn't in a positive space, that certainly can impact your ability to combat a physical illness.
Yeah, we actually see that when somebody is having a physical depression, what I say is physical depression is different than a psychological depression, where a physical depression actually does give you more fatigue. It depresses the immune system. It makes your body harder to fight cancers. And the same is with anxiety. If you have cortisol squirting and adrenaline squirting, it's good for the alert survival instinct, but over time it exhausts your system and makes you feel overwhelmed, and it's hard to focus or be productive. And so there's a lot of things that if we don't kind of keep it in check, we want enough of it to keep us kind of having, I call it kind of our motor going, where it just kind of goes, kind of that we keep ticking, but we don't want it to override us, that we can't go to sleep. We can't have restorative time. We can't have our body have moments of repair or rest. Yeah.
For those of you that are just joining us, I'm speaking with Dr. Valerie Correa, who is a psychologist and an oncology psychologist at Legacy Health Systems. What are some of your concerns you have right now that we're into this pandemic with the breast cancer patients, and especially the metastatic breast cancer patients that you are working with?
Yeah, I think the thing that I have been hearing from a lot of my patients is that sometimes they might have had surgeries or treatments that they had a whole team supporting them, and that was really giving them a sense of peace and encouragement. And then with this stay-at-home order, which they totally feel like is a good idea to have more protection, but it kind of tanked their whole ability to have all their A-team behind them. And then now it's hard to get somebody to take care of their kid or their pets, or to bring over food, or to do transportation, or go to their treatments with them, or sometimes who they have as a spouse or a main caregiver in their home isn't always the best caregiver. And it puts a lot of stress on that caregiver to kind of up their game. And sometimes those people didn't have a skill set to do that, and they weren't even expecting that person to do it because they expect all these other people to do it. So I think that's been the biggest shock for people, is they're like, here, I prepped and did everything in my control, and then here's another thing that is out of my control that keeps showing me I can't change my fate. And then that becomes a depression trigger or a trauma trigger, because it feels like I'm trying so hard to get ahead of this, and I just keep on getting a slide back. And one of the things that I kind of tease them about is I find that humor is very helpful in dealing with hopeless situations, when you can hit the right feeling of it, and I always say, you're not only dealing with metastatic cancer, you're dealing with a pandemic on top of metastatic cancer. How many cancer survivors can say that, and so kind of putting it in perspective of like, this is like a once in a few times in our whole civilization situation, and it's kind of ramming right in the middle of their existential crisis. And so you have a whole world around you kind of having a similar psychological space of feeling their own mortality and challenging themselves. And they can find some people who sometimes can empathize more with their situation, that they're like, okay, this person finally gets what I've been going through, but they still have a choice over removing themselves from the probability of getting it, where I'm still in the mix of this. And so I've been really encouraging people to try and have the conversations with people who seem to empathize or seem to have that insight, to be able to share that, it'd be really helpful that if you take this experience and understand what I've gone through. So, yeah.
Though telemedicine is something that is likely being done much more in different ways, as Nathalie shared last week, Dr. Johnson, you raised a great point of you don't have your A team, and that just simply can't really translate through on telemedicine. Mm-hmm. And yes, all the stressors of the family unit being together in a way, having children at home, they still need to be taken care of in homeschool or schooled with distance learning, and spouses being together. There's a lot of forces at work that really make things much more complicated and stress inducing, as much as we have time to be together as family.
Exactly. And one of the things that I've worked with some of the people that I'm working with is they've literally said, I only have so much quality time left right now. Am I going to spend the time in resentment? Am I going to spend the time angry that my family can't be there for me the way I expected them to be, or my friends couldn't be there? Like, I have to get to a place where I can have joy in my day and I can enjoy these little moments that we have together. And it's a psychological Olympics to do that sometimes, so just having key people that understand, whether it's a therapist or a friend or a pastor or just a online support system, any of those organizations or people that you can have that show some empathy to those challenges are important.
So it's a nice segue. The pandemic is certainly a source of anxiety for everyone in the world right now, no matter your circumstance, especially immunocompromised individuals like breast cancer patients, but even more so challenging for people who have underlying challenges of existing mental health conditions, such as clinical depression or anxiety disorder, bipolar disorder, and other conditions. How does treatment in these cases change?
Yeah, I think, most people who have anxiety or depression or trauma or bipolar, they're usually sensitive, receptive people. And so when they go through a trauma such as cancer, that ups the ante of their coping of like, oh my gosh, now I have to not only deal with just daily life being stressful, now I have to deal with my own existence being questioned. And then now we have this systemic stress around them that they have to decide how much they're going to absorb that global stress and how much they need to remove themselves from the global stress. And that's oftentimes what I'm talking with people is, where is the most important thing? And the most important thing right now is your survival, is your care. And that is kind of how can we refocus and get you to what you need right now. And a lot of cancer people are so lovely people that they're so used to taking care of everybody else that it's so hard for them to assert their needs, ask for what they need, and be self-protective. But in this situation, it's so important for them to be able to say, this is what I can and can't do because I'm at risk. My body is already fighting for survival. And so I cannot put myself at risk for an additional trauma to my body. And so it's really important for them to have a professional team, such as mental health team, like a therapist or a support group, or a psychiatrist if they want to take medicine, or a light box if they need to do that. Know that if you do light box, if you have bipolar, if you're not depressed, it's going to put you in a manic phase. So only do a light box if you don't have manic episodes. And so, But right now they can't do acupuncture. They can't even go to a massage person. So some of their normal care team that they normally did to keep their mental health up, like maybe they always walked with a girlfriend, or maybe they always went to a support group, or maybe they were in AA and went to an AA meeting, that there's all sorts of things that they did to kind of keep their self-care and their health up. And then now they're having to find remote alternatives and virtual alternatives, like online. Like what we're doing at Legacy is allowing me to see people on video visits or telephone treatment. And so finding those practitioners and organizations that are saying, we're going to step up and find a way to do this remotely, so you feel cared for, and that we're fighting for you too, and we want you to feel supported. And so I think it's really being an advocate for yourself and finding that virtual team, because maybe who was your in real life team is not accessible to you.
Thank you. Someone answered this next question in terms of what are some ways we can prioritize our mental health, especially when our physical health is the reason behind our worries. But perhaps if you want to elaborate on that, if you can. But I think the other two pieces that one would want to know is, well, what might we stop doing, or what activities might we do less, and maybe what activities might we do more of?
Yeah, we find that exercise is just consistently good for the body and the mind. And there's all sorts of research that supports that. So I think anytime, if you're not in a space that's safe to go for a walk because there's too many people around and you don't have exercise equipment at home, there's YouTube videos of like Qigong exercises that are really great for people to just kind of shake off toxic energy and the stress of being overwhelmed, or Tai Chi or yoga, and just anything to move your body. When we think of just like not being stagnant in the heaviness of the stress, that sometimes just movement helps loosen up the mental part of that too. So I would say exercise is really important. I think valuing sleep is really good. Our brains do a lot of work in our dream life to kind of make sense of the world when we're sleeping. And so really saying that if you're having a hard time getting to bed at a certain time, just every night try and go to bed 15 minutes earlier than you did the night before. Don't try and say like, I'm going to do 2 hours earlier. Try and do small increments that are able to do, and make sure you limit access to electronics 2 hours before, and do something that calms your nervous system. And one of those things is as simple as breathing, that if we breathe down to our belly button, I'm just going to breathe and show you how to do it. Just if we breathe like that accesses the part of our brain that tells us to repair ourselves and to calm our body system. If we breathe short in our lungs that only go up this high, or hold our breath, it activates the part of our brain that's more animalistic and more for survival. And it may be great for fighting cancer, but it will get exhausted and fatigued and then lower your immune system. So we have to kind of give it a balance. And so getting ready to go to bed, I do a little exercise with some clients that I learned in my hypnobirthing to give birth was, and I find cancer patients really enjoy it, is just as simple as closing your eyes, doing that deep breath, and then visualizing one color of every hue and intensity of something, almost like a card catalog of the olden days or a Google image. And you just do, like, if you did purple, it would be like all the things that are lilac color, all the things that are plum color, all the things that are eggplant color. And gradually your mind just starts going in a dream state, and it'll release the stressful things. So sometimes we just need to play games with our brain and just say, you need a break. Stop ruminating and having your worries just swirl around. So the other is that the media sometimes is not healthy for us to be 24/7, to be hijacking that animalistic alert brain. And so really decide how you want to get information and how frequent. And so sometimes it may be good to like look in the morning and look at the end of the day, and then also look at who your sources are. And and try and read sources or see sources that feel calming to you. So like some people are feeling that Como is very soothing to them right now, or I find that Justin Trudeau is very relaxing, even though he's in Canada. And so sometimes even having different people be giving you some information if you feel like you need a different emotional tone. So I think reading information in the way that you do, like you can still be informed, but not be activated all the time. So
The Canadians in general are soothing.
I know.
I have Canadian
I find
family.
those connects there, my friend.
I have Canadian family. You raised a great point that Dr. Johnson brought up last week. Minimize stress-inducing news because if you watch it constantly, it could send you in a tailspin. To make light, because smiling is good, right? You said, we should turn off the electronics a couple hours before we go to bed. It's hard for a lot of us to do because we're all on Netflix and other streaming sources. But Dr. Johnson gave us the green light. It's okay to watch Netflix. Just make sure you turn it off.
Yeah.
There'd be a lot of sad people here if we were recommending otherwise. I have 2 more questions for Dr. Correa, and then I've got a few that came in from the community before this call. But as a reminder, please do forward your questions now. We will put them into the queue, and we will read those aloud so Dr. Correa can expand upon those and answer questions that you have and or concerns. All right. Moving on to kind of resources, what type of resources might you recommend for those impacted by breast cancer, those who absolutely cannot leave their homes and are currently quarantined away from their loved ones?
Yeah, I think that the nice thing, you and I were talking about this before we started, that we just really have a very rich community that really cares about cancer patients. And there's multiple organizations that are available online right now for people. And so some of them is Komen, some of his legacy is having like my sessions online for people. And also we have art therapists and some other services that are online. The Pink Lemonade continually is a just all-star group that does beautiful things, support groups online. Breast Friends has been wonderful. The Ovarian Cancer Alliance is great, which are sometimes breast cancers and ovarian cancers. And Lacuna Loft is another one. And Sunrise Daisy normally is, but right now you can go on their Facebook and sometimes we'll just post other resources that are others. OHSU has some free resources. I know that Providence, I'm not sure if they're having online right now, but they normally have some great couples resources for people too, and family resources. So I think really going online and getting in a community, I think just make sure that you connect with people who have positive life energy, because it's easy when you get on the internet to go to organizations that sometimes will enhance the trauma if it's not regulated through a therapist or a mental health advocate, and so just be self-protective, that you really start connecting to organizations that are lifting you up, giving you life energy, making you feel resilient, and really connecting to what you need emotionally.
Dr. Correa shared several organizations that are resources in the community that you can find at our website at comenoregon.org under our resources. So please do visit the site to follow up with some of those organizations and see what they have. As for your sessions at Legacy, where would one go, or what website might they go to access?
They can do the Legacy classes, but our healing center is it's 503-413-6550, and I'm usually about 2 months out from people getting to see me, but if they get on a waiting list, then usually we can get you in sooner. So it's good to get in when you can, and then we'll try and get you in soon. And then like what we were saying, humor, I think really making humor a priority. When I was sick, I literally just watched light, funny things all the time. And that also shows that there was so much research that humor improves immune function. It helps interpersonal relationships. I always find that couples that can joke or diffuse tension through laughter or, humbleness, that usually smooths a lot of hurts and disappointments. And so, yeah.
My wife gave me the biggest laugh of my day this morning. I can't tell you what she said, but it was a high point this morning.
I know. And the thing is that I always say, part of cancer is so absurd. You know what I mean? Like there's just some absurdity to it. Like it's just like this, like here I'm going through cancer and now there's a pandemic. I mean, there's just absurdity to it. So
Come on.
I think sometimes you can even just laugh at like, how bad can things get here? And so some of that can even just discharge some of the tension of just like, oh my goodness, so just letting some levity into your life is important.
My last question before we go to our viewer questions is for those who are really struggling, what can they do to protect their mental health?
Yeah,
I mean, you've said some of it already, but
yeah, I think it's really making sure that you have a team in place. So if things started to shift downward, you already have the connection. So let's say you do sign up to get therapy, or you have a psychiatric nurse practitioner or psychiatrist that gives you medications, or you have a relationship with your PCP or your medical oncologist to say like, I'm really struggling right now. And so they kind of have you on the radar to check on you and make sure that they are easily accessible to give you. If you do need medications that are anti-anxiety, I always say, you have cancer. It's okay. It's okay to take an anti-anxiety medication when you have metastatic cancer. So it's not like you're not going through a difficult time. So sometimes it's that, sometimes it's talking with naturopaths for supplements and other, yoga instructors or massage therapists. Maybe even they can't give you a massage, but they can give you some suggestions of websites that can give you stretches and exercises that could feel better. So I think plan a kind of a safety plan for yourself before you actually feel so bad. So then that way, when you feel down and are struggling, it's easier. And then tell someone you love that plan and hand them the plan. So then if you are in a space where you feel emotionally paralyzed, they can say, honey, it's time for us to do your plan, and that makes, you just need the beginning of the wheel to create momentum. And then if you're already here and doing this, you're already resilient. So once you get the ball rolling, your own resilience will start kicking in because you are fighting for your life. You're wanting to live. You're wanting to have memories and experiences. And so we just have to get the synergy back going. Okay.
well, thank you for your professional and personal insights and perspective. I know it's very much appreciated by those on the call. Certainly, I am very grateful to have this time with you. I'm going to turn to, we have 3 questions that have been asked prior to this call, and I'm sure others will be coming in. So if you do have a question, please tee it up. This first question comes from Marilyn, and I'll read it aloud because it's fairly lengthy. Thank you, Marilyn, for submitting this. Her comments were, surely lots of Komen women will want to know if they will continue to shelter in place as long as they undergo chemotherapy until there is a vaccine. For people with metastatic breast cancer with limited life expectancies, this is especially mentally challenging. I maybe have 8 to 12 months when traveling to see my family in Europe is safe, and I can't go. I may never be able to go. Multiply this for 1,000 ordinary things like tea with friends, a pedicure, a massage, a normal trip to the infusion center, buying plants for my garden, aside from Zoom meetings. And what kinds of mental health boosting social activities can women in treatment engage? Long-term strategies, please.
Yeah, I'm going to answer this in a way that I've answered it to some other people who had ideas that they thought they'd have the physical capacity to go do things, and then their body started shutting down and they weren't able to do the things that they expected to do. And that is that sometimes if you can't go visit or be with people that you care about and you feel like your time is getting limited, when I was in private practice before I worked with cancer patients, a lot of times I'd work with kids who lost a parent or a family member who lost another family member. And the things that they really cherished, because sometimes at the moment of somebody's loss, they're kind of shell shocked. And it's not sometimes till years later that they long for something. And sometimes what they really need is an essence of you. And they need to know who you were as a person, not just their mom, not just their sister, not their grandma, but who you were as a woman, as a man, and that some of our people are male with breast cancer. And so people writing, like sometimes if you just, what I tell some people, it's too hard to write a letter to somebody of what somebody means to you and memories that you've had with them. Just do dot phrases, just do a dot and then give a memory, write down a memory that you cherish. And then do another dot and a cherished memory. And then soon enough, you'll have a whole piece of paper of cherished memories of your life or your life with them. And it gives you a life review, and it gives you a sense of meaning of what your life has done. And know that those are the things that people cleave to when they miss you. And that I have found very touching. So even just a video when you're feeling healthy and you're able to joke, just hearing, like I've had people say, I just having their laugh, just knowing how they laughed on the thing is healing to me. Or having it be that, I got to see my parents kiss each other, give each other a hug before my mom died. You know what I mean? Like sometimes it's just like seeing those images or pictures or things that you wish for them. It's really painful work. And I have to tell you, I did it for my son and we still have it, the piece of paper, but I'm so grateful that I did it. And afterwards, it gives you so much relief that you don't have to hold on to that it allows you to fight harder to live, because you're not holding the fear of them not having that. And it's really hard, but it is important. And so I would say, if you can't go somewhere or do something, just start writing it. And then if this gets lifted and you do get to go to that trip, it's so meaningful to do it in person with the person and say, I wrote this when I didn't know if I was going to be able to see you. Look I'm here. I'm doing this trip with you right now, and then they get to have that. And then you get to have it, have 2 copies, and then, just have it be with you and them. And so, but those are the hard moments of cancer that a lot of people don't want to sit in. And it's just really difficult. And those are the things that are hard. The other is that, you can try and like create, if you can do painting or art or writings or poetry or anything, if you do quilts or anything that's a tangible item or something that you love and you're saying, this is what I want you to have of me and this is why, like all of that is just really powerful for people. And it takes emotional energy to create that and do that. But you've got the time right now to do that. And it's really powerful.
Thank you. Kristen is asking you, what are some tips for managing stress and anxiety when you have to make trips back and forth to the hospital for treatment?
Yeah, I think one of the things is first doing the protective things for yourself. One of the things that having leukemia taught me is because you don't have an immune system, they just really wrapped you all up to make sure that you didn't get anything. And so really make sure that you are wearing the mask, that you are washing your hands, that everybody that is with you is taking off their shoes and not bringing them inside, and making sure of how you're getting your food and things like that. But also tell your care team that I'm nervous coming in for a lab. What are the precautions as you're going to be with me to do that? Sometimes we have to tell medical providers did you wash your hands? Have you changed your gloves? I mean, don't be afraid. Part of my job in my own recovery treatment was sometimes telling a doctor, I didn't see you wash your hands. Go back and wash your hands, whatever. And they'd be like, oh yeah, I'll do it. So they're human people and they have really busy and overextended. And so it's really easy for them to sometimes just have a lapse in judgment, and that's on your life. So feel free to let your medical team, just know I'm having anxiety and I need everybody to kind of be on their game. And then when you're there, if you see something that doesn't feel right, call them out and say, I need you to be wearing a mask, or I need you to, to wash your hands or anything like that. So I think that's the first thing. I see that as being the hardest thing for cancer patients, is asserting themselves when they need to assert themselves. And then I think if you can do the slow breathing, I think doing some meditation on the way that you're driving there, having some visualizations of how it can go well, really kind of almost talking to your immune system of saying, here we go, we're going to do it, and then really, be mindful in the situation of, I'm making a conscious choice to do my medical care and protect myself, because right now the cancer departments are open to protect people, but they're doing all these things to protect their patients. So I think that's the thing to know, is that all of the departments care about your health and well-being, and that's what they're striving to do during this crisis. And then when you're done, to do the same thing on the way home, is kind of breathe a sigh of relief that I've gone through this, and think positively of how you've invested in your health. And then when you get home, take a shower and just kind of imagine all of that tension just kind of dissolving out, or do a yoga pose, or, anything that's relaxing or mindful is helpful.
Great, thank you.
Mm-hmm.
Last question before we go to live ones is Marianne's question. And we touched on this a bit earlier, but I want to ask it since she poses it. How do you keep from getting sucked into the news? I want to stay informed, but I don't want to be depressed.
Yeah, I think you can see real quick a visceral response very fast. So if you're finding yourself kind of panicking or traumatized, then you can always tell yourself, this is not helpful to me right now. I need to go do something life-giving and regroup, and then I will come back and be informed. But this is not helpful to me. And so I think, know that there are other people responsible for the pandemic, and you are not responsible for the pandemic. You're responsible to your health, your mental health and your physical health, and the people that you love. And sometimes part of cancer is us learning what we can control and what we can't control, and exposing ourselves more to the people that give us a sense of control than the people that make us feel out of control.
Okay, thank you.
Mm-hmm.
With that, we want to turn to live questions. Alice, if you have any that are queued up, feel free to ask those of Dr. Correa.
Absolutely. We did have a couple of questions come in. From Lori, we have, how do you tell the difference between depression and disappointment?
Yeah, I think that's really good. I always say to cancer patients that grief gives you a sense of relief, and disappointment is sometimes grief. Sometimes it's disappointment in how someone's treating you, how someone doesn't have empathy for you, someone doesn't have insight for you of what you've gone through or what you're going through. And usually there's a moment of situational awareness and acceptance that you can't force someone to be empathetic. You can't force someone to be insightful. You can't force someone to be compassionate, And so usually once there's that realization of, I'm hitting a wall of influence, I can't seem to talk them into understanding my position, then there's a point that you can retract and invest back in yourself. But depression makes you feel like everyone's always never going to be there for you. It's these always and nevers. I've never had someone there for me. No one's ever going to be that. Then you feel paralyzed. You feel stuck. I always call it molasses. And that feels different than just regular fatigue. There's a despair that is different than the despair and grief. despair and grief, you can be in a ball crying in a fetal position, but then afterwards you're like, whew, thank God that I got that out of me, but depression is like, I can't get out of this position and somebody needs to help me out of this position because I can't get myself out of it. And so those are the moments that are very difficult for people with cancer and depression. And those are the things that you need help. And when you need to, either call a psychiatrist or a psychologist or a therapist, or have it be that you go into the ER if it's any imminent risk, or because the reality is that any time that I've worked with families, it is much more difficult for a family member to get over the grief of a family member who died of suicide than it is to have cancer. And so the most important thing is that your family members feel that you wanted them, loved them. And even though someone has mental illness and struggling when they're suicidal, it's not always easy for the recipients and loved ones to understand that it was not about them. It was about the level of the disease and the intensity of depression that took their life. But for a survivor of someone of suicide, it's extremely painful. So at any point you feel your life is threatened, or that you feel challenged in that way, that's the best way you can love your family and yourself, is to go get help.
Thank you. Another question we had says, can you offer some tips to coping with the loss of your job due to cancer? With an MBC doctor, I was not able to return to my position. I feel like I'm grieving the end of my career. This may apply to many who are finding themselves unemployed during the pandemic.
Yeah, I think that there's a whole organization called Cancer and Careers, and I really recommend you going on that website because they saw this happening to people. There was some research that showed that when people had cancer, very few people even returned after treatment to work, because our society isn't always understanding the emotional complexity and the physical demands of cancer. They just think, oh, you're done with chemo or radiation. They don't realize how ongoing it is. And so I think that's the first thing, is finding places that sometimes will allow you to reevaluate. I was just talking with a guy today that, maybe it's not the best idea to think about what you need to do to get back to your same job. Maybe we need to start brainstorming ideas of what you can do right now with the limitations that you have. And it's a very painful thing. It's a grief thing. I had the same thing when I had to close my practice for 3 years and had lovely people I cared about that I had to disconnect from. And it's a very painful process. It's part of your identity. It's very hard to lose a part of your identity when you're fighting for your life. And it's extremely painful. And so just know that, honor it, but also know that sometimes it's a moment of transformation of, in this moment, this job showed me it's not right for me. They're not going to be my team to give me what I need to get through this. And so I need to find a new way of being, if you want to work, that is going to honor where I am right now, because what I need right now are supportive people that are invested in my immune system, in my survivorship. And that is important. Yeah, but it's hard.
Anne wants to know, are there any books you might recommend?
There's so many books now out that I haven't had the time to read, so I can't really recommend certain books exactly, but I do know that there are a lot of good ones right now. So I would say go to Amazon and just kind of go through it. And then once Barnes and Noble is open again, go and sit, or an independent bookstore, and sit down in those areas and just look at what feeds you. But I usually really feel like it's important to not read about cancer when you're dealing with cancer. I think it's more important to read about life stories and inspirations and things that are life-giving. And what can you do to connect to that life energy and the things that are important to you on an emotional level. And if your body is getting activated in a story, even if it's fictional or nonfiction or historical or anything, sometimes those are those narratives that we need to rescript ourselves through cancer. And each person's cancer journey is individualistic, just like a marriage is individualistic, just a parenting is individualistic. We all are very varied in our ways that we cope and deal with things. And so I think I would say open up yourself to read a lot of different narratives of life. And, I find that sometimes reading historical figures that were resilient and kind of went through adversity is sometimes really helpful to me when I feel weak or vulnerable. That sometimes just hearing about somebody else going against the odds just can be easier to read than reading about somebody surviving cancer. So I think really pay attention to what you need to feel empowered.
Great. We had one more question come in from Karen, and she wants to know, with the added isolation as a result of the pandemic, what would you recommend to those who live alone and don't have anyone to lean on for support?
Yeah, I think the nice thing that is happening right now is because there's been some research just in the last year of how difficult social isolation is impairing people's immunity, and that there's a lot of people who normally have social anxiety. I was just working with someone yesterday, and we talked about how normally she would have anxiety going and doing something in the community, but right now they're offering it online. So it's going to give her an opportunity to go into these online virtual organizations, start meeting these people that she doesn't know or have any connection to. And then when the safeguards are taken away and lifted, she will feel more comfortable going into these groups and then showing up because they're already going to know her. So I think don't be afraid to go in, because right now I think there's more awareness and investment in making sure that people know that they care about each other.
Thank you for answering the additional questions that Alice shared. We're so grateful to have you with us here tonight.
Yeah.
I know before we began the call that you said your son was outside taking care of the labradoodles, so you could.
I don't know if you heard the door with the labradoodle scratching and then them closing the door, and so yes.
So it's getting dark out, so we want to let you go. But
exactly.
Before you
Luckily,
do,
there's a trail. He's just going around the trail. Yeah.
Well, share our gratitude with them for all of us viewing this call with
I'll make him cookies tonight. Yeah.
Do you have one final quick thought you want to leave our guests with?
Yeah, I think one of the things that I would want metastatic cancer people to know is that you are resilient and you have an inner strength that some people have never even tapped in yet in their life. That you have a knowingness, you have a centering, you have a focus and attention to your own life energy. And I want you to harness that. I want you to feel it, and I want you to feel empowered by it, because it is moving to me every time I meet with a survivor and see that inside of them. And you have that light within yourself to share with others. And sometimes that's the biggest gift for you to give others, is to show that strength and that vulnerability. Yeah.
Oh, thank you, Dr. Correa.
Mm-hmm.
I want to end by sharing how much we appreciate you. I also want to just remind people that a lot of resources were talked about, and ComenOregon.org, that's KOMEN, Oregon, one word, .org. You can find many of these resources. You can also find out more information about our Treatment Access program, as well as our Health at Home series. As we continue each week with this, there's a motorcycle going down the street.
And I want to thank you guys. I really appreciate you, filling the void and really connecting to our community and meeting the needs that we need. So thank you for your work and effort and accessibility. So thank you.
Wonderful. And we will continue the conversation along the lines of our own mental health and well-being. And we will be gifted with the presence of Sue Best, who many of our viewers likely know, a licensed clinical social worker. And she will continue this conversation, and you won't want to miss out on that. So thank you again, everyone. Have a wonderful evening, and be safe, be well, and all the best to you and your loved ones.
Take care.